This is Inspiring Women. I'm Laurie McGraw. I'm speaking with Kathy Kaluhiokalani, and she is the CEO and founder of Pip Care. And this is part of our collaboration of Inspiring Women with Redesign Health, where I am showcasing some of their top CEOs and founders of companies. Kathy, I'm so excited to have you on Inspiring Women.
I'm excited to be here. Thank you so much.
All right. Well, part of the reason I'm so excited to have Kathy on this podcast is because this is not your first rodeo. You have led other companies, and this is a new company that's just been brought out of stealth. So you've been at it a little bit, got some exciting news here at the health conference, which we will get into. But Kathy, I'd just like to get a little bit of your bio sketch. You've done a number of different companies. You've been in healthcare a long time. You've been successful. And so how did you get here? Give us a bit of the background.
So background is, I think, I've been in healthcare for almost 20 years now.
Yep.
I initially wanted to go into healthcare as an attorney.
Yep.
That was actually the path that I was taking. And then after some conversations with attorneys who said they would never, that's not what they would do if they had a choice to go back, I realized that probably as an operator, that's where you can have the most impact in healthcare. I had a personal story with our youngest child who was born with some challenges. And so that's really was my exposure to healthcare. And so I said, this is what I want to do. And so just my career, I've been fortunate. So I've worked for large scaled health systems.
Yep.
I've worked in private equity in multi-site, multi-state where we've scaled significantly.
Yep.
We were fortunate to have an exit to Optum, and I spent time at Optum, which is even more scaled healthcare under the UHG umbrella.
Sure.
So that was all fantastic. I think what that all taught me is what I love is healthcare that truly has an impact and that is going to also create meaningful growth. You typically don't find that in large scaled organizations, which is how I ended up coming back to start up healthcare.
Okay. So, I mean, having that experience in large scale organizations that gives you an appreciation of scale and sort of like, size of issues and stuff, but also the layers of different administrative bureaucracy sometimes that you have to deal with. But going all the way to early stage startup is a pretty big leap. Okay. So what drew you to that? And I want to talk about Pip Care.
Yeah. So what drew me to that, I think, is that post-pandemic, I started thinking about what is important in the healthcare ecosystem. I think what we learned is big healthcare happens in health systems.
Okay.
Typically, prior to the pandemic, in my experience, health systems felt they could do most everything on their own.
Yeah.
Right. And I think what they've realized is what we do really well is deliver great healthcare.
Yep.
Where we probably could use partners is how do we digitize that healthcare? How do we scale that healthcare?
Yeah.
How do we enable great patient engagement? And so I consciously said to myself, this is a place where I want to go. And I was very fortunate in that Redesign reached out to me and said, hey, we have this concept. Let's talk about it. And I said, so what space is it in? And they said the surgical space. So obviously incredibly important in this country for a multitude of reasons, but also we have an aging population, right? And when they talked about the concept of providing a journey for patients, so it's not segmented, right? We don't have pre-op and then post-op and then care coordination and it's all kind of jumbled together. How does a company make that seamless and partner with health systems to do so?
Okay. So we're going again from like these large scale organizations serving hundreds of thousands, millions of patients, out there. And now to something that's doing a particular segment, and surgery is one of the more complicated areas, right? I mean, you're dealing with, some of the most expensive, to things. And a lot of the expense comes from outcomes that happen outside of the hospital. So how does that tie into, so maybe what is Pip Care? Give us the concept.
So the concept is that there's something called ERAS protocols. It's a fancy name for enhanced recovery after surgery. And these are things that anesthesiologists and surgeons do with their patients today. And so it's prepping yourself for surgery. Right? So it could be nutrition, it could be, exercise, it could be quitting smoking, it could be all those things, right? And so that's kind of in a nutshell how it started. And then what we said at Pip Care is, okay, clinically what we know from talking to patients is they will do the things that their physicians ask them to do. But it's confusing. They get a packet, they're trying to look at pages, and they don't really know beyond that what they should do. And so we said, okay, digital is one aspect of that, but there has to be a human component to
Yep.
it. And so what we did is we said, okay, we're going to pair the digital technology with human health coaching.
Okay.
And that's the model, right? So they are referred into us depending on specialty. We're teeing up things through an application that we built. We partner with the health system so that those surgeons can tell us these are what we want our patients to do prior. And then we work with them both through video means, asynchronous messaging, and through the application to track their progress.
Okay. So, I mean, if you're going in for surgery, I think everyone can relate to this, no matter what the surgery is. I mean, from the patient perspective, you do follow whatever it is that that what you're being told to do, but you're nervous.
Yes.
You are nervous and overwhelmed and confused and all of those things. So when you say you're coaching and you're that, digital support and personal support, I mean, I'm imagining that you're sort of like calming people down, and this is what these steps mean, and you're doing okay, or you're not.
That's right. I think it's first explaining why do we do these things to get ready for surgery.
Yep.
Right. And so it's saying, okay, you have a partner in this, and we're going to take you through every step of the way, and we're partnering with your surgeon.
Yep.
So understand that we are just an extension of that care team. So it's calming nerves. It's explaining what their NPO instructions are, which is when you can stop eating and drinking prior to surgery.
Okay.
Right? It's things like that. It's making sure that they understand when they come home, is your home ready?
Yeah. Okay, so Kathy, in terms of that interaction, and so just if there were no Pip Care, what are sort of like the rates of people following the instructions that they're given, and just I have a question, like, why isn't what's already being done good enough? How big is this problem?
That's a great question. So I think what's already being done, let me say it this way: health systems and surgeons, they deliver great clinical care.
Yep.
Where they're maxed are the administrative pieces of ensuring that when I give a patient a protocol to follow, I follow up with them to make sure that they're doing that, and I can answer questions.
Yeah.
Right. I don't know that necessarily needs to live in the clinical realm as what we've learned working with health systems. So where we come in is just what you said earlier, providing the support to ensure that they're getting those things done, that any questions are being answered, and that we're also going through things like, has my insurance been coordinated? Yes, check that box.
Yeah.
Where do I park? Yes, check that box.
Yes.
Because we don't need, nurses and nurse practitioners and physicians getting calls back about where should I park on the day of surgery.
Sure. And I as somebody who has had not, tremendous surgery, but I've dealt with those types of incidents, the smallest of things you spend time on. And, for somebody who's got something complicated going on, it just is overwhelming. Tell us about some of the data. So outcomes, what are some of the things that are beneficial, pure numbers wise?
It's great. So the first thing I like to say is, well, we're great at patient engagement. We are not a patient engagement company, right?
Okay.
We are partnering with health systems to improve outcomes for their patients. So the data shows us that when you leverage ERAS protocols and do a organized effort with a patient, you're going to reduce their length of stay.
Yep.
You're going to reduce ER visits, and you're going to reduce readmissions.
Okay.
And we actually have a study coming out with our pilot partner, UPMC, in the next 3 to 4 months that will show the data we had during our pilot.
Oh, and I'm assuming that data might be positive.
Yes,
just a hunch.
Yes.
Just a hunch, Kathy.
Yes.
I'm very, very intuitive here.
Yeah.
Okay, so I understand you've got some news. You're sharing with people at Health. You've got a new customer here.
Yeah, so we're incredibly excited. We are going to be launching with U Chicago Medicine. Going to be working with them and their patients, and doing a study with them as well. We're fortunate and very excited to be partnering with them.
Well, congratulations on that. It's like great news.
Thank you.
Who buys Pip Care? Is it the health system that you're actually selling to? Is the employer who's
Yeah, that's a great question. So today it is the health system that we're selling to and that we're partnering with. I think there's opportunity when you mention payers and employers as we gain more data and more traction in the space.
Yep. There's also a lot of just trends of sort of hospital at home and those kind of things. Does Pip Care I know you're at an early stage, but are you thinking about sort of like more in that space of what types of care can you further bring back to the home, or is that not in your line of sight?
So I think that's a great question. I actually think this is a level of hospital at home already, right? Because patients before and after surgery, so other than the episode of when they're in the hospital, this is all being done at home.
Yep.
And so it's already a version of hospital at home. Is there an opportunity to expand what that model looks like? Absolutely.
Yep. Well, yay. Let's keep working on that. But Kathy, I also want to talk a little bit more about leadership. Okay. So you have, what has it been, a year that you've been out of stealth with Pip Care?
Oh, yeah. Wow.
A year anniversary. Happy anniversary to you.
Time flies.
But it's not your first rodeo. No. This is not your first gig as the chief executive. So I'd like to just get some perspective. What are you bringing to Pip Care that is maybe lessons you don't have to learn again that you did before, and maybe what's new? What's a new challenge that perhaps you didn't have before? I'd love some perspective.
This is a great question. So I think one of the things I bring, as you mentioned earlier, so I'm a little bit of a rare leader in that I've done startup and large scale. It usually doesn't work that way. So I think one of the things I bring is that understanding, I have perspective. So startup is very up and down, right?
Yeah.
It's a great grind, but you have great days and you have days where you're like, wow, this is hard. And healthcare is hard anyways.
Yeah.
Right. And so I think what I bring perspective to is that's okay. If we just keep doing the right things for the right reasons, we're going to continue to expand the company and support health systems and support their patients. I think the other thing that brings is that brings a calmness to your team. As you're building and you're bringing folks in to build the team and grow the company, I'm able to alleviate any stress around the ups and downs and say, this is all perfectly normal.
Yep. Well, that is good perspective, and to be able to be calm with those level of stresses that are the reality of being in your position is wonderful. I want to bring it a little bit to just the state of women in leadership, and part of the main reason I started Inspiring Women was to showcase incredible women so that others would follow in the footsteps, and we could just close the gender gap that is still there in the area of leadership. So, what are your thoughts on that? Big topic.
Big topic, big question. So women leaders in healthcare, women leaders period are important, but specifically women leaders in healthcare, it has to happen. And here's why. Women come with a different perspective.
Yep.
Right? And so we've lived, you and I specifically, right, because of our timing of our careers, we've lived in a male-dominated healthcare environment. And so what I've learned a lot sitting at tables.
Yep.
And the more perspective we get around a more diverse ecosystem of how we get to solutions that are solutions for everybody, and that also means people who live in rural areas, people who live in urban areas, people who live in suburban areas. Those are all different needs that need to be met. And I think women in particular, we raise children, we look at things differently. And I think we come to the table sometimes with solutions that are out of the box. Mm-hmm. That maybe wouldn't get to the table if we weren't sitting there.
I think that's a compelling case for why more women are needed in leadership. Maybe, Kathy, you could share some of the reality is it's still hard and it's different. Okay. So not all the role models are there and not all the people are pulling women into leadership. So that's just reality. I mean, I don't need to bemoan it to you, but how do you think about that from the perspective of closing that gender gap, the numbers, whatever it might be for women? What should they know so that they can further accelerate? Nobody needs to redo what the previous problems were, but how can we further accelerate the road ahead?
So that's a great question. I might look at it a little differently than others. I think it's incumbent on people like you and I who've gotten there to bring those women forward.
Yep.
At the right time in the right place, we should be looking at how we build our teams. And I ultimately think that we need to be demanding is a strong word, right? But we need to be demanding that when we look at leadership teams, they look like the world we live in today, the country we live in today.
Yep.
But I think we have voices now and we have to use those voices. And I think one of the ways you do that is you go back in and you mentor folks that are younger in career.
Yep.
And you show them a pathway.
Yep.
That for others just seems, of course, that's what I would do. I don't know that that's always true for women in healthcare.
Yeah.
And so us going and showing them this is the pathway.
Yeah.
And I'm going to help you get there.
Yeah.
Is important. Giving them a voice when they don't have one yet.
I have heard from actually a number of senior executive women like yourself, this idea that it actually is our responsibility to bring others with us to the table.
Right.
And I feel like this is a, there's a lot of energy or emergent energy around this topic of, it's not enough to just get there yourself. It's actually you bear some responsibility to bring others with you. And there's an agency in that I think is really compelling, kind of thrilling.
It is. It's fun.
And yeah, it absolutely is fun. It absolutely is fun. So just going back to building companies, you're building something in a different way with Pip Care and with Redesign. So I just love, in UPMC and, others. So how is this model different? And what are you excited about that's helping you in terms of as you're building
This is a great question. I've always built strong teams that operate, right? But there's a digital component to this. And so that has been exciting for me, right? We've brought something to market that we've built that is going to enable the operation. It's not something I had experienced before. So having a partner like Redesign Health, having, another partner like UPMC and UPMC Enterprises to help us and myself think through what's important in that technology, how do we make sure that it functions well, but that we get great patient engagement and that we don't make it cumbersome.
Yep.
We make it fairly seamless.
Yep. So if you were to paint us forward 5 years out, your biggest vision in terms of what you're going to impact with Pip Care, what does that look like?
That's a great question. I think 5 years out, we are nationwide across, I won't even give you a number, right? In the healthcare ecosystem, specifically with health systems. And I think that we have materially impacted patient outcomes and patient engagement in a way in which that it's irrefutable.
Yep. Well, thank you, Kathy. I love that because it's more than just building a successful, financially successful company, but having an impact on patient outcomes would be amazing. And you started by telling us about the aging population, which we know is there and in need of things like this. This has been a great conversation. I really appreciate the time. I always love to close out. I mean, you've been there, you've done that, you're here now. Your advice for younger women who are starting out so they don't have to relive the lessons that you learned the hard way. What is it?
Believe in your gut and don't apologize ever.
The end. The end. Thank you so much, Kathy. I really appreciate this conversation. This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.